Good afternoon, everyone. Thank you so much for joining us today. I'm Melanie Anthony, the State Medicaid Director, and Trailer and I have been doing some webinars to make sure that providers are informed of all the flexibilities that the feds awarded states during the COVID-19 crisis. And today we wanted to spend some time with our dental community. So I will turn it over to Trailer, and he can introduce our dental director.
Sure. Hi, I'm Trey Rains, Deputy Medicaid Director at the Healthcare Authority. Thank you for joining us today. And real quickly, I introduce Dr. Karen Luce. She's our new dental director. She and I actually started our same day at the Healthcare Authority a couple of months ago. Feels like it's about a year already, but
you think a lot has happened.
So thanks for joining us today. So yeah, as Melody said, we wanted to kind of give you a brief overview of the flexibilities that we've been able to get from our federal partners at the Centers for Medicare and Medicaid Services in regard to the emergency period. So the state did apply for and received approval for what they call an 1135 emergency waiver. That gave us certain flexibilities around multiple items. And so one of those was provider enrollment. So if we see a need to enroll providers more quickly because of the emergency period or care issues, we're able to waive those fingerprint-based background checks, for example, the site visit, as well as application fees. So if you are in need of that kind of response, reach out to our provider enrollment folks, and they will help get you an expedited contract. Now, I will say anyone that comes into the program through the emergency period, and we've waived those requirements, we will require that you go through standard contracting procedures once the emergency period is over. We've also made important decisions around member eligibility during this time. And part of that is in relation to the Families First Coronavirus Response Act, which gives the states an enhanced 6.2 federal matching participation rate, in addition to our regular FMAP, to help defray the costs that we expect to see increased during the emergency period. So one of the conditions of accepting those dollars is that we cannot make any adverse member eligibility determinations during the emergency period. For purposes of that piece, the emergency period began on March the 18th, and it will go until the end of the month in which the president declares that there's no longer a national emergency. So the only reason you should see a member lose eligibility during this time is if the member chooses to be unenrolled or if they have left the state. So we have diligently worked internally with our online enrollment staff so that they are pushing back all of our renewals that would have occurred during the emergency period. Right now, we've pushed all the renewals back 60 days. And so we're still doing those data verification checks with IRS, OESC, and Oklahoma Tax Commission, but we will not make an adverse decision for eligibility based on any of those checks. We've also reached out to and are working with our partners at the Department of Human Services who do the eligibility determinations for our long-term care population and a few others, and they are also aware of this. So I would say, though, we know that there's going to be individual circumstances where folks may lose eligibility based upon we haven't updated the rules in every area in our system. So if that does happen, please reach out to our member services hotline, and we will work to get their eligibility reinstated as quickly as possible so that there's no lapse in coverage. One of the first things we also did, as you know, the emergency was declared by the president on March the 13th. By March the 16th, we had opened the majority of Sooner Care reimbursable codes open to telehealth. We originally reviewed those dental codes and had originally decided that we were not going to open any codes for dentists at the time. But upon further research and reflection and understanding and hearing feedback from you all and understanding what flexibilities we have, we did go ahead and open one of those codes. And thanks to the great advocacy on the part of Dr. Luce, we did go ahead and open those. And I'll share the global real quick so you can see that. Dr. Luce, if you just want to give a brief highlight of the code that you identified that's appropriate parameters.
So the appropriate code to use is the D0140 or limited exam code, and that can be utilized for Atella Dentistry when it's coupled with the D9995 code, which designates that D0140 in this circumstance is being utilized with teledentistry. So those two must be used together, and then we will reimburse for the D0140 when it's coupled with the other code, 9995. You must have, just following the ADA guidelines for teledentistry, as well as the Oklahoma Healthcare Authority, it must be a real-time, two-way communication between the provider and the patient. The patient must be able to interact with the provider. The provider must be able to access notes prior to the appointment and make documentation afterwards. The patient must know what's being done for them, and it's basically a way so that you can triage and determine whether or not that patient really needs to come into your office. And so it hopefully will keep some people out that maybe didn't really need to be coming in.
That's great. A common question I've gotten, not to put you on the spot, around teledentistry, or can you give kind of an example would be appropriate, or what kind of symptoms the patient is having?
So if anybody's having, so as all providers know, due to the ordinance with the CDC and Governor Stitt, we're only to do emergency care, emergency and urgent care. So this is when the patient is symptomatic and you're determining if this is really an urgent or an emergency situation where something needs to happen in the office when a prescription isn't going to be enough for patient education. But something needs to be done urgently that can't be put off until later.
Great, thank you. So we received a question around orthodontia. They say, we are an orthodontist office and know that we are allotted a flat fee for first, second, and third year payments. However, with new COVID-19, we are seeing and talking to patients on the phone. Can we charge additional fees for telehealth?
I would say if you're actually doing a limited exam for something, probably not. But if it's stuff that's usual that you're just doing more often or more frequently, then I would say not.
Okay, thank you.
Hopefully that answers, clarifies it.
And I can clarify too for the attendees that we have created a COVID-19 response website on our public page. The address for that, and I think Corey will put it in the chat box too, so you can see that, is okhca.org/COVID19. If you scroll towards the bottom of that page, all of the recorded webinars from the last week, I think we've done around 7 or 8 so far. Those are all recorded and posted under their relevant provider group, as well as written questions and answers that were received and answered during that session. So a lot of these questions will overlap among provider groups. So we just want to let you know that if you have questions that were similarly answered in previous recordings, you can check that out. I did kind of want to cover, since telehealth may be new to a lot of providers on this call, typically there are certain technological platforms that are approved for use for healthcare and that are known to be HIPAA compliant. For example, the Zoom meeting we're on today doesn't meet HIPAA standards, but Zoom does make a product specifically for healthcare providers that they have worked with the Office of Civil Rights at the federal government and signed a BAA to ensure that it meets standards. However, during the emergency period, OCR has released guidance that's essentially waiving enforcement of the HIPAA standards as they relate to technology platforms, specifically around telehealth. So only during the emergency period, you can use whatever technology you have available to you to provide that service. So if both clients, for example, have an iPhone, you could use FaceTime, which is not typically HIPAA compliant because Apple hasn't signed a BAA with OCR. But whatever technology you have available to you, feel free to use during the emergency period. Now, the only thing that we've seen that would not be acceptable is anything that is known to be public facing. So you wouldn't, for example, be able to do a FaceTime live or anything where you know the other members of the public can access that service. But if it's known to you to be a one-on-one communication, so I gave the Facebook example, Facebook Messenger does appear to be individualized and not open to the public, and so you could use that to communicate. Now, we are not reimbursing for messages sent and received, or what we'd have traditionally called store and forward, where you take a picture and send it, or email communication. those interactive audiovisual two-way communication would be appropriate for the D codes that we've mentioned so far. See, we have another question. Is the D0140 via Atella Dentistry for established patients only? If not, is there guidance concerning minimum information that must be obtained to establish the patient?
So is the provider asking, is this for established patients only?
Right.
Okay.
Yeah.
No, this code, the two codes together can also be utilized for a new patient. So the provider would need to, of course, get the new patient information though via intranet. Somehow the patient would need to fill out all the new patient forms, and you need to have all the usual forms that you need for a new patient history, health history, dental history, all of that. You'd have to have access to the patient's full information. So if the patient was not able to fax that or scan it to you, that might be an issue.
Okay.
Whereas if it's an established patient, you would have that in your office already.
Gotcha. So the second question kind of adds on to that. What level of documentation is required for a teledentistry visit? And are audio, video recordings to be stored and retrievable as part of the health record? So on this, I'll answer the second part. You actually do not want to record and store those. I believe part of the HIPAA privacy part of it is that it's a non-recorded session, but you would document as if it was an in-person session. So whatever would be required of healthcare authority documentation rules for a visit of this nature, go ahead and record it and note that in the chart just as you would an inpatient. I'm sorry, in person.
Yeah, documentation should be as thorough as if it were an in-office visit. Absolutely. And Trailer, I noticed per our telehealth policy, we're also requiring providers to not only do chart notes, start and stop times of the video, service providers' credentials, and provider signature as usual. The only new thing would be a stop and start, I think, in there.
And there's also mention in the, I'm glad you brought that up, the telehealth policy around for minor children need to be presented by a parent or guardian. That can take shape in a few forms. The parent can either be on the other line and you see them and talk to them and let them know that they are presenting the child for that service. Or you could text the parent, receive an affirmative text back, or make a phone call just so that they know that the individual session or exam is about to take place, and then that's noted in the chart as well. Are there any additional D codes that are currently being for telehealth?
Not at this time.
And we'd also add, we've been getting a lot of good feedback during these sessions. And so if you are a dentist that has had extensive experience around telehealth and you feel that maybe there's a recommendation you'd like to send to us, we are also open to looking at that. For instance, we've added several codes that were not previously covered over the past week. And after dialoguing around provider groups and getting their input. So yeah, to reiterate, not at this time, but if you have an idea, just send it to us. Does dental have a specific mailbox that they received Q&A to?
Yes, dental services at okhca.org.
All right, well, we kind of assume this might be a quick one since we have one code. I've gone over the majority of the flexibilities that would be pertinent to this provider group, but I would reiterate again, if you have any questions, check out our COVID-19 response page. Almost all of our resources that we've discussed today, along with many others, are out there, along with all the other flexibilities we've gotten from CMS around how we can be more agile as a state Medicaid agency in responding to the crisis. And we're, Dr. Luce just mentioned the email inbox. Send your questions there and we'll be happy to get back with you. That's my closing notes. Dr. Luce, you have a few parting words and we'll take it over to Melody to close us out.
I would just like to iterate if anyone has any suggestions regarding telehealth. This was all new for everybody. We're exploring new territory, at least in Oklahoma and in this field. So don't hesitate to make any suggestions. We're open to listening and considering them. So.
And I just want to thank everyone again for attending today. And if you would like us to do a repeat, we are definitely open to that at any time. But I do want to thank Dr. Luce for being available today and helping us figure out the best way for our dental providers to continue to receive and be able to do services for our population. Thank you.
Absolutely. And thank you to my team for being here.